You can just bring it over here like this and just do a little tuck. And make sure that they're warm and comfortable. You can just check in with them, especially if you know that they're awake. You can ask these kind of things then for them. So again, we're going to start by getting a little bit of oil on the legs. And with their ankles, it's a good idea to look if there's any kind of swelling. She just has a little bit of just mild swelling, if anything. But again, pitting edema, and us as massage therapists, we can't diagnose these things, so we can't say pitting edema or anything, but we can recommend them not to get a massage in certain areas. And what I've read too is pregnant women are 4 times more likely to have blood clots in their legs just because of poor circulation. And a big problem too with pregnancy is once they give birth, the pregnant women, they're not looking forward to like stretch marks and those kind of problems. So there's things that you can use like cocoa butter oil or cocoa butter lotion and stuff that might help out, but again, there's no guarantees with those kind of things, but that's what some people use with it. So again, we're going to start with this, and if you need to, you can even elevate the leg even more, so you can put another pillow underneath there to elevate it more if they do have any kind of swelling. So the more you can raise it kind of above the heart or right at the heart level, that's where it's going to help to drain everything then. So again, more pressure towards the heart. And pregnant women, especially in the end of the 3rd trimester, it's going to be a little bit harder for them to shave their legs. So just be aware that you might feel a little bit of prickly sensations in that area. So again, more pressure towards the heart, less pressure away from the heart. And you can use even your forearms or your elbows a little bit in this area. And what I'd like to point out here is, right here she has a scar. She had surgery way back in the day. But with a scar, you can perform like a lot of like cross fiber friction. And I can even feel some scar tissue build up there, but the more cross fiber friction in that area, the better. And another technique that's really beneficial too is myofascial release. So I have another full video on just myofascial release techniques. And these areas that they can get to themselves, you can teach them techniques themselves. And again, cross fiber friction is usually the better technique. And slower the deeper, of course. And when you're going up, you can even kind of vibrate and kind of shimmy down. Another area to pay a little bit more attention, especially in the end of the 3rd trimester, is right in the groin region and the adductors, because if they're going to be in the stirrups giving birth, that area is going to tense up a lot more. So that's the area we want to relax and massage more on a regular basis then. So what we're going to do with that one is we're going to bring over the knee, lift up the knee a little bit, and externally rotate. So we can get at this area. But as you can see here, she's not too flexible. So you might, if you want, you can ask permission. You can put your knee up on this area, so you can massage like this, or you can get a pillow or a bolster and put it underneath there too. Or if they're comfortable like that, that's okay too. But again, this is the area you'd want to concentrate on a little bit more. But again, not really deep pressure, but just enough to relax the muscles. And if you're going to perform any kind of stretches in this area, you just ask permission to cup the opposite side of the hip like this, then push down on the knee then. So again, cup the opposite hip, and some people are ticklers, so you'd have their hand there, and then your hand on top to hold it. Then you can just stretch out that area then. And you can even perform like broadening techniques, kind of separating, like this. But again, more pressure towards the heart, less pressure away, of course. And then when you're done with that area, just slowly bring it back, of course. Try not to hyperextend the knee, of course. And then you can kind of lift up, kind of glide down too. One of the best stretches for a pregnant woman, I want to stretch out the gastrocnemius and soleus region. What we're going to do for that one is I'm going to cup the calcaneus right here, hold here, and just kind of lean forward. So again, I'm going to cup here like this, and just lean forward, but I'm going to place my hand here and then lean forward like this. And then let me just show you from this, again, I wouldn't be on this side stretching it out, but just to show you a little bit easier. So compress, and then stretch. Because you don't want to stretch it and then compress it. Then you're going to push too much in the knee region. But pregnant women in general, they have a lot of cramping in the calf region. And my wife, I mean, virtually every single night she woke up screaming. And the first time I hit that area, because that's what I do for when I have cramps, and I never did that again because I got hit myself. So with that one, again, we're going to compress and then stretch that area out. Or some people just like you just to squeeze that area too. So again, all depends on what they can handle for that pressure and to relieve that kind of cramp.